first and foremost, I want to say a special thank you to the people behind me. We have been fortunate to assemble a team of some of the most highly skilled people, like I said in the beginning, in the state of New York. Talented individuals who are committed to making sure high-quality services are delivered, innovative solutions are brought forward, and taxpayers are protected. That's exactly what a government should be all about. Delivering essential services and having great respect for the property taxpayers as well, the people ultimately paying the bills. This proposal meets the criteria that we talk about on a regular basis in our organization. It isn't about a bigger government or a smaller government. It's always been about a better government. And so this is designed not for the savings. This is designed to be able to make sure there is long-term sustainability and the deliverability of services to people in need. And that does that in an environment that is forever changing and always becoming more fiscally challenging. And so with that, I'd like to open it up to any questions that anybody may have. Michael?
Yeah, well, are there any layoffs associated with this?
No. And again, I think it's important to highlight this has been done with extensive conversations with CSEA. And in that process, we're very pleased to say that they have been very supportive and again, they are fully behind this proposal.
Okay, now one other, and then I'll let other people grab. You mentioned, I know you mentioned the 13 transferring. You first mentioned a category of 18 employees. And what were those 18 doing?
LGU, yeah.
Okay, so they're so what?
We're augmenting the it's important to understand, we're augmenting the LGU.
Mm-hmm.
That's a critical component to this. And we want to make sure that we're not just providing same as service. We want to expand and provide higher quality or again greater access to. Those are important components of what we're doing here. So the LGU is important for us to be able to strengthen, and then there are the additional personnel that we were talking about before.
So those 18 which are augmenting the LGU, what are they doing currently?
The majority of them are in the LGU. We're only talking about adding 2 or 3 more
Okay.
positions. Yes.
You mentioned the new gun laws. Can you go into more detail of how this CARES program is going to?
I mean, sure. With the New York Safe Act, there's responsibilities placed upon local governments. And this allows us to be able to better meet those responsibilities.
And if I could just add to that, it's not only to meet the responsibility about reporting people who are at risk of gun violence, but really, as I mentioned, working with law enforcement to have more secure communication and safety planning across systems to make sure that we all have prevention efforts, to prevent these things from happening in the first place. So it's all of that.
Because you mentioned a contract with Hudson Valley Mental Health.
Sure.
Does the county have to pay anything for them to come in and provide these services?
Again, but before Ken does that, I think it's important to also highlight, we really are looking forward to having the Health and Human Services team work with the legislative committees that are appropriate to be able to work through this process. We're very excited about what we believe is a truly innovative plan brought forward. Much like many of the other plans that we have brought forward in Ulster County, they really are extremely innovative and often are being replicated around the state. Ken, you want to talk about that?
Sure. The contract that will be before the legislature envisions a 6-month transition. As part of that transition, there would be a reimbursement for certain startup costs with the new provider up to $150,000. It includes all kinds of things. The major component of it would be a implementation of an electronic medical record. Remember, this is a provider that has a full presence in Dutchess County. They would be coming across the river and setting up the new clinics in our space. So there's a transition that's part of that, and there is some startup costs provided by the county for that.
Would there be an ongoing payment after the initial startup payment?
Yeah, the way that the contract works is that in lieu of additional payment, the county will be providing professional staff. Okay, so if you were to look at the overall value of the contract, it's approximately $1.3 million annually. But the county will satisfy that commitment through the providing of professional staff that will be working in the clinics.
Michael, this really creates a hybrid public-private partnership in this process. Pat,
So these folks will continue to be county employees, but they will work for this new,
they'll work side by side. They'll still remain under county employee.
what will this organization do? specifically?
Provide clinical mental health care side by side with Ulster County clinical care personnel.
So that will they be taking, because you said there will be no change in counselors, that those people who are currently in programs now will continue with their same therapists or
Yes,
whatever?
yes.
So then will the new people be funneled into this new organization? I'm just a little bit
You're
confused
talking
about.
about new entries into the system.
Yeah,
Yes. That's an expectation that we'll have in this process. Again, it's very important to us that we have the continuity of care for existing clients. And as much as humanly possible, that's exactly what we're going to do.
so then you, in essence, will be privatizing any new clinical care patients,
We
is
think
that?
of it as a public-private partnership, yes.
In terms of the 13 that are being transferred to DSS, what do they do currently for mental health, and how will the workload that they currently provide be picked up under the new plan?
Sure, a lot of the work product of the current 13 employees is billing and other clerical work associated with the operation of the mental health clinics. Since we will no longer be operating the clinics, those staff will be able to transfer to DSS and do similar work. We've been able to do comparability using civil service law and identify where an account clerk doing account clerk functions at mental health will be able to do account clerk functions at the Department of Social Services.
I think it's also important to highlight here that there shouldn't be the misunderstanding that the status quo is even possible. Status quo is only possible if you dramatically increase local spending every single year to be able to accommodate that.
Yeah, and just to follow up on that one, because you said they're doing billing and clerical work currently in mental health. So who's going to be handling that billing and clerical work next year?
That would be Hudson Valley Mental Health. The county's providing professional staff, so that's limited to doctors and other licensed therapists who will be working in the clinics.
So people existing employees of theirs, or people who they bring on would do
That's
the billing
correct.
and clerical.
Those functions will be provided by staff of Hudson Valley Mental Health.
That would be-
And you said that this ensures that people will be able to get mental health treatment regardless of their ability to pay, that Medicaid, that people who don't, I guess, get Medicaid but don't have private insurance will also be able to get, and how does that work?
I mean, I think it's important to really discuss that piece of it as well. There were choices before us, and those choices were all unacceptable. One of them was drastically increasing property taxes every single year to support an escalation that was unsustainable. The other choice was the reduction of services to people in need. That wasn't acceptable either. And so those were the drivers that made sure, when you have those two as the key choices or options before you, it was the driver of the creativity behind the Ulster Cares Initiative.
But I guess what I'm asking is, currently, are there people who seek mental health services that are unable to get it through the county's existing program?
You're asking because of insurance?
Well, yeah, I mean,
Contracts or the
it says
uninsured?
here,
Yes.
if I could find it, excuse me. Reduce access by only serving Medicaid eligible clients, leaving hundreds of residents without mental health treatment.
Correct.
Yes.
That was
Are there-
something that we weren't willing to do.
Currently, you do not. Currently, people, even those people who don't get Medicaid are able to
We have a
get.
sliding fee scale that
Okay.
accommodates everyone.
And this will
Hudson Valley
continue to
Mental Health
have-
does- Yes.
Will it be the same sliding scale?
You know, those details haven't been worked out, but we will certainly, as the LGU, have a part in the development of that.
With the end goal that is very clear, to make sure everyone in need of services is able to access service regardless of their ability to pay.
Currently, I believe there's a couple of units up at Benedictine Hospital where you could check yourself in for mental health. There's an acute unit and a regular unit on the second floor. How is the closure of Kingston Hospital and the merger of the Health Alliance of the Hudson Valley into one building there at the Benedictine campus going to, what's gonna change here with regards to the CARES program? Is there still gonna be a unit at Benedictine Hospital?
I think it's important to understand this is separate and apart from that, but I think it's important to touch base on that, so.
Yeah, no, Health Alliance certainly is in control of those mental health beds at their facility. And they do tell us that they do hope to be able to continue the same numbers, et cetera. this is where the LGU function can come in and be very vigorous in terms of our support with the state, the Office of Mental Hygiene. Remember, there are 3 state agencies that ultimately govern all of this for us, this world of mental health in New York State. And as the LGU, we can certainly be advocates with the Office of Mental Health and the Office of Alcohol and Substance Abuse Services to make sure that we have the allotment of beds and critical access facilities that we need for our population. So that's gonna be another role of our LGU, to ensure that. But ultimately, those beds and the numbers of those beds is ultimately up to Health Alliance and the state in terms of their approving them to continue those services. But we will be at the table advocating for them.
And the state has made very clear they want the continuation of that bed in those facilities.
You said that you will have 18.
Oh, by the way, I should also say a special thank you to the state OMH, who also played a pivotal role in being able to counsel us through this process to make sure that everything we were doing, they were going to be very supportive of it, which they are.
You said that the county will be providing professional staff to the Hudson Valley mental health.
Correct.
Will they have additional professional staff of their
Yes.
own?
Yes.
They will not work, they do, but they will not work in the clinics. We have adequate staff to continue to meet the demand moving forward. So it'll be the same staff, professional staff, working under the umbrella of Hudson Valley Mental Health. It is county employees.
In terms of the savings, I know you had said 120,000 in the first year. What, if any, savings is anticipated in future years?
I think it's important before we even go there is to acknowledge the reality that aid has been cut by 50% in the last 4 years. Unless someone
Yeah.
can tell me what that aid scenario is going to look like going forward, that's an impossible question to answer.
Well, I guess I was talking more in terms of
Assuming-
on the expenses end. Obviously, that's a revenue as the state aid. So on the
Correct.
expenses end, how are expenses? What savings and expenditures would there be beyond the first year?
Sure, well, let me talk a little more clearly about what the $122,000 number, how we get there, just to give you a sense of it. We currently spend approximately $4.3 million on our 3 clinics here in Ulster County. Approximately $1.3 million of that is revenue generated from billing. The remaining $3 million is the county share. Those are the funds from the county that we use to support that system. So under this plan with the train of ownership, for us to keep all things equal, we had to identify a strategy where we would backfill or replace that loss of $1.3 million of revenue that the clinics would normally generate, since the county will not be operating the clinics. Approximately $200,000 of that revenue is federal aid that the county gets to support our staffing that transcends the clinic. So we'll be able to retain $200,000 of that. That leaves $1.1 million. On top of that, we're able to find some savings from eliminating a couple of vacancies that we have in the department. We're able to cut approximately $176,000 of expense because we're not operating a clinic. If we're not operating the clinic, we don't need a contract for cleaning, for example. So there's a whole list of contracts that we're able to eliminate. By transferring staff from the Department of Mental Health to the Department of Social Services, and with the change in function that they will be performing, we're able to draw down a substantial amount of federal and state aid, about $450,000 on top of that. And then on top of that, the Hudson Valley Mental Health will be leasing from the county clinic space, some furniture and equipment for their use, which will generate over $100,000 of revenue for the county. So when you add all of those components up together, that's where we get to the initial financial benefit to the county from the proposal. And as time goes on, we'll see more savings. Under this plan, we've retained all of the professional staff from the county, but as those doctors or therapists leave county service, the county won't be doing additional hiring to perform that function. Hudson Valley Mental Health will hire that replacement staff, and the county will then reimburse Hudson Valley Mental Health on a schedule that's set forth in the contract. That the cost of the county staff and benefits is more than the subsidize the other operation. So over time, as staff leaves, we will not replace staff, and Hudson Valley Mental Health will hire replacement staff. That's the function that will produce the long-term savings for the county.
So you're, and thank you for the detailed explanation. So you're in years 2 through infinity, are you anticipating that the annual savings is greater than or less than that 122,000 for the first year?
Because if you were to map out, if you were to, let's say that all of our staff retired next year, and get a comparison between that and the other payment we make to the provider, the savings could be close to $1 million over time. But we don't anticipate that. I mean, we have a core group of professional staff that are senior with the county. They do a great job, and we envision that they'll be providing these services to our residents for a long period to come.
And again, I think it's important to highlight again, this wasn't designed about cost savings. It was designed around long-term stability of the provision of service. It's a critical part here. When you're seeing these kinds of significant reductions in aid, what you're trying to do is preserve access to services. That's a critical component of this. Again, with that,
Do you know what your, you talk about loss of aid, what has your aid been in recent years?
Yeah, this is aid specific to the clinics. There's a chart in the packet that illustrates the actual dollars. But in 2008, the state began a massive restructuring on how they reimburse Article 31 mental health clinics across the state. So over time, we've seen dramatic reductions. I mean, in the heyday of these services, the state would reimburse practically all of the expenses associated with this treatment. But as they have moved to redesign Medicaid and restructure, they have taken away a lot of the support. So what we've seen is more regulation, more demand for service, but substantially less state support for those services. So really, as the county executive said, this strategy is designed to help us bring sustainability to these services that we know that are needed here in the community.
You said that this organization already operates in Dutchess County. Is it a similar program there?
Yes. Okay, and with that, I'd like to say a special thank you again to each and every one of the people that were involved in the Ulster Cares Initiative, in the Health and Human Services team that worked so diligently on this. And as we say time and time again, not about a bigger government, not about the smaller government, it's about a better government. And because of the people behind me right now, that's exactly what's happening in Ulster County. So with that, thank you very much.
Did someone turn the heat up?